What is artificial insemination? Rather, nowadays we prefer the words intrauterine insemination, which stand for IUI. That is true. You can still call it an artificial insemination, although there's a big difference between the two. But however, artificial insemination is a fertility treatment method to deliver a sperm directly into the uterus, bypassing the cervix in order to achieve pregnancy. In this process, most of the time, in this situation, what we do also is what we call sperm wash. By definition, it's just preparing of sperm or separating sperm from semen or seminal fluid, so that when you inject that sperm, or inject only the sperm into the uterine cavity. The process of IUI step by step. The first step, it's whereby you talk with your doctor and you agree that you're going to use IUI as a form of assisting you to be pregnant. And for you to use IUI, which is intrauterine sperm injection, for you to be pregnant, there are 3 or 4 conditions which you must qualify to be able to do the process. 1, from the female side, the reproductive organ or system must be normal. By that, I mean the uterine cavity must be clean, no problem, no fibroid, no polyp inside. The fallopian, no fibroid in the uterus as well. The fallopian tube must be patent, either 1 or 2 must be patent, must be open. There mustn't be any obstruction of the tubes. And thirdly, you must have ovaries which are ovulating or which are producing eggs or egg. From the male side, it's extremely important as well that you must have sperm concentration of between 10 and 20 million. As I said, anything below 10, the chances of IUI success are very low. The second, the sperm must be motile. In other words, there should be movement. The sperm must be able to swim. And that we expect at least 30% of the sperm having a forward movement. The third, it must be morphology. At least the sperm 4% must be normal according to Kruger criteria. Then if that has been done and we agree, then we can start then with the process of IUI. You cannot do an IUI if you have bilateral tubal obstruction. You cannot qualify for IUI if you have bilateral hydrosalpinx, fluid in the tubes both. You cannot do IUI if you have tubal ligation. It means the tubes are being clamped, or clips have been put there, or tubes are being removed, what is called salpingectomy. Therefore, IUI, mainly you have to have open functioning tube. Then the step 1 is medical treatment. That can be with oral medication or with injections. That should take you around 2 to 14 days. And then the second step is monitoring of growth of the follicles using a gynecological ultrasound, and wait for the follicles to be around 18 to 22 millimeters. In that case, an injection can be given so that you can ovulate. And the sperm preparation can be done the following day, or at 36 hours after you had an injection to trigger you to ovulate, and sperm preparation can be done, and then sperm can be injected into your uterine cavity, and then pregnancy test can be done around 10 to 14 days after the process. Now, artificial or IUI may be indicated as well in the following group. After 6 months of trying with no success, these people are what we call unexplained infertility, because everything is okay. The sperm numbers is okay, concentration, movement is okay, motility is okay, and everything. And looking at the reproductive system from the other side, the fallopian tubes are okay, the uterus is okay, the ovaries are ovulating okay. After 1 year of trying naturally and you're not getting pregnant, it is time to think about IUI and approach your fertility specialist. In case where we know that there's a male factor problem, that can be genetic or that can be genetic, in that case, maybe you want to do a donor sperm, then IUI may be used. We do IUI as well for the same sex couple. In other words, two women trying to be pregnant. In that case, we use a donor sperm to assist them to achieve pregnancy. How successful is IUI? Success of the IUI depends on the following factors: the age, the fertility medication you're using. It's more successful with injection than oral medication. Underlying factor which cause infertility: endometriosis, pelvic infection, hydrosalpinx, all those. If one tube is affected, then the chances that pregnancy will be low with IUI. Sperm count, as I said, and sperm motility. Success rate of IUI is about 41% after 6 treatment. In other words, after 6 attempted IUI. Can look it the other way and said it's about 40% after trying for 6 months. What are the benefits of IUI? I would say the first one is cheap. You follow probably more natural process. Helpful if your partner have a genetic problem. In that case, a donor sperm can be used. If your partner have a lower sperm as well, but it should be between 10 and 20 million, or your partner have a borderline motility, which is then it can be assisted by taking sperm 50% up to the uterine cavity, or if patient have unfavorable cervix, or he's got any antibiotics which preventing the sperm to ascend through the cervix into the uterus to the fallopian tube. Therefore, it's very important that we know that IUI, it can be used as a form of treating, although it's got a very, very low chance of pregnancy rate. Can IUI increase the chance of having twin pregnancy? No, IUI cannot do that. However, the medication, fertility medication, is the one which can increase your chance of having twin pregnancy with IUI. Thank you.